Can someone under the age of 18 get a nose job? Welcome to the center. My name is Dr. Babak Azizzadeh. I'm a facial plastic surgeon that specializes in facelifts, facial reanimation, and rhinoplasty, located in Beverly Hills, California. Here, we talk about all things facial plastic surgery. Welcome to the channel. In this video, hopefully, we will give you a global viewpoint of undergoing a nose job or rhinoplasty, including what to expect at your consultation, what type of rhinoplasty surgery you need to have, and the overall risks and goals of rhinoplasty. I'm Dr. Babak Azizzadeh. Let's talk about it. Can someone under the age of 18 get a nose job, which we call rhinoplasty? So the answer is yes. And in fact, probably the largest population of individuals who do get rhinoplasty or nose jobs are teenagers between the ages of 16 and 18. As far as candidacy goes, it really depends on a few factors. The most important one being gender, because females tend to develop their facial structures, their bony structures at a younger age than boys do. So for boys, we tend to be a little bit more conservative than for young girls. So there is no specific age for each gender. We really want to know a few things. Number one, for girls, we want to know when they first had their period, because that will determine their facial skeletal growth. Also, has their height and facial appearance been very, very stable for at least a year or so? So that's really critical. For boys, we tend to wait a little bit longer until about 16 or 17, because that tends to be the main time frame that boys stop growing. The reason there is an age constraint is because we don't mind as much about the nasal growth, but inside the nose where the septum is, that's the part of the body that allows our cheeks, our bones, the upper jaw bones to grow. So if that area is violated, operated on, damaged, it could really impact the growth of our midface. And the midface is a critical component to our beauty, attractiveness, and that's why we want to do rhinoplasty only at the appropriate timing. So to research the type of doctor that does great rhinoplasty is complicated. Younger kids and adults are using social media, Instagram, YouTube, TikTok. That tends to be great at identifying doctors, but it doesn't give us the whole picture. Adults tend to do more research from personal word of mouth, doctors, other people, or other families that have had rhinoplasty. I love mixing the two because it empowers the young adult who wants to have surgery, as well as the parents or the families that are going to be a part of the decision making. So that's really a great way to go. The reason you need to have a super expert do rhinoplasty, regardless of age, is that it's a very difficult, complex surgery. Three-dimensional, it has beauty in it, it has aesthetics in it, it has plastic surgery, it has architecture and structural forms. So very few doctors do rhinoplasty at a very high rate, and complications and poor outcomes are very common. Even in the hands of the best surgeons, you could get results that are undesired. Then let alone if someone's not doing a lot of these surgeries, or are not good at it, or don't have the aesthetic eye for it, or don't have the technical aspect for it. So it is crucial to find a surgeon that really understands beauty, aesthetics, plastic surgery, and rhinoplasty. So the consultation for a rhinoplasty in a young adult, especially if the parents are involved in the financial portion of it and support portion, really needs to involve everyone. If one or the other is not on the same page, I tend to say no, because we need to have the parents completely on board, we need to have the young teenagers completely on board, and I need to be on board for the surgery to be done in the best possible way and we get the best possible outcome. So what's the consultation like? The consultation, obviously, for me, a lot of listening to what the concerns are, making sure that my patients, both the parents and the young adults, have reasonable expectations, and they're doing it for the right reason. Number one. Number two, it's a lot of education on my part, because I have to show what the nasal anatomy is, how rhinoplasties perform, what the aesthetic eye is, and show a lot of before and afters. And the third component is really morphing software that allows us to show, not exactly, but a vision of what I would like to do and make sure that that corresponds to what my patients and their family members would like to accomplish. When these things go well, my patients are educated. I also have a better sense of if I can make my patients happy or they have reasonable expectations, and then it becomes a home run. So the risks of rhinoplasty are actually overall very limited. It's a very safe surgery, but the number one thing that can happen is a result that the patients aren't happy with. That's a very common occurrence. Literature tells us maybe 5 to 10%. I actually think it's a little bit higher. Now, if you choose the right doctor and you have the right reason for doing it and everyone's on the same page, I think the chances are over 95% that you can have a phenomenal result. But this tends to be both doctor-related and patient-related. The other risks of surgery are common surgical risks. Postoperative bruising, swelling, you could get a little asymmetries, you could get a little ridges. Those are things that we see fairly common, but most of the time they're not very obvious. So it's critical, again, to have the right reasons to do surgery and find the right surgeon to do your surgery. So what should be your expectations after surgery? So I call it the 3-phase recovery. First phase is that first week to 10 days. Swelling, bruising, you have a cast on, those all come off. And most of my patients, not all, most, in about 10 days, they're out and about, socializing, going back to their day-to-day. Phase 2 is the swelling really recovers. The bruising really goes away. Everything's really looking better. And that generally takes about 3 weeks, 3 to 4 weeks. So phase 1 and 2, typically 3 to 4 weeks. The last phase is a phase that you require a lot of patience, because all the subtle issues, the refinements, the contour, the final results sometimes takes up to 2, maybe even 3 years. The reason that's very different than any other body part is because the lymphatic drainage and the way that the skin of the nose wraps around the underlying structure just takes a long time to heal. And different individuals, if you have thick skin, if you're doing a revision, it takes longer than if someone has thinner skin and primary surgery. So these are critical components that you need to be aware of before jumping into doing rhinoplasty. So I hope you've enjoyed today's video. I think it's an important one, actually, because these are questions that come up all the time. If you've enjoyed this video, please comment, like, and subscribe to our channel, and hopefully give us other topics that you're interested in hearing, and we'll see you soon.